Welcome to my presentation titled, Does Cannabis Use Impact Cognitive Behavioral Therapy Outcomes for Anxiety and Related Disorders? A preliminary examination. Cognitive behavioral therapy, or CBT, is considered the gold standard treatment for anxiety and related disorders. Research has shown that individuals seeking CBT for anxiety use cannabis at an elevated rate. However, no research has examined the impact of cannabis use on CBT outcomes for anxiety and related disorders. There has been research that has shown that cannabis use is associated with cognitive and motivation impairments. Cannabis use has also been conceptualized as a subtle avoidance strategy that may reduce anxiety in the short term, but maintain anxiety in the long term. The purpose of this study was to examine whether cannabis use frequency and cannabis use disorder symptom severity impacted CBT outcomes for anxiety and related disorders. It was hypothesized that individuals with more severe cannabis use presentations would experience dampened treatment outcomes compared to less severe cannabis use presentations. 253 adult participants seeking CBT for anxiety and related disorders at a specialty clinic were categorized as frequent users, infrequent users, and non-users. They were assessed for and diagnosed with an anxiety or related disorder by trained clinicians. Please see the yellow table for diagnostic details. Participants were then referred to a symptom-specific CBT group that matched their most pressing anxiety or related disorder. Participants completed a self-report cannabis use disorder symptom severity measure, which included an item on frequency of cannabis use at baseline. They also completed symptom-specific anxiety measures each week of CBT. Results showed that although all three groups started with similar baseline anxiety symptoms, frequent cannabis use was associated with significantly poorer CBT outcomes compared to non-users, which is consistent with our hypothesis. However, frequent users still experienced a significant decrease in their anxiety symptoms from pre to post treatment. These results are represented in the graph in the results section, where we see the pink line representing frequent users, the green line representing infrequent users, and the blue line representing non-users change in anxiety and related disorder symptom severity throughout treatment. Cannabis use disorder, or CUD, symptom severity did not predict CBT outcomes. These findings are inconsistent with previous research using brief CBT, where cannabis use did not impact outcomes, but consistent with research suggesting that baseline cannabis use moderates outcomes in an integrated CBT for cannabis use and anxiety. Notably, infrequent users did not experience negative CBT outcomes, consistent with previous research. Given that cannabis use frequency, but not CUD symptom severity, predicted CBT outcomes, it is important to study factors related to cannabis use to understand their impact on CBT outcomes. There are various ways that frequent cannabis use might interfere with CBT outcomes. It may be that negative cognitive and motivational impacts of cannabis use make it more difficult for frequent users to effectively engage in CBT, which is required for optimal outcomes. It may also be that high frequency of cannabis use is a subtle form of avoidance, which maintains anxiety in the long term. Cannabis use as a subtle avoidance strategy may be harder for clinicians to target if the therapy focuses on overt avoidance. Further research is needed to investigate these hypotheses and address limitations of the current study. Limitations included lack of comprehensive cannabis measures that include factors such as cannabis product, method of consumption, or quantity of cannabis used. Our diagnostic subsample sizes were small and prevented comparisons of the impact of cannabis use on CBT outcomes between diagnostic groups. And finally, our sample was demographically homogeneous, which prevents generalizations of the results. Thank you for listening to my presentation, and please feel free to reach out with questions.